Hello.
Hang on.
Hi, and welcome back. Welcome back to Center Radio. This is COVID-19 in Indiana, episode 12. My name is Gerald Smith. Today is Tuesday, April 21st. And today, as usual, we are joined by Dr. Sybil Moore as our co-host. Our guests today are Tom Stutzman, the Director of Emergency Management at County of Indiana, Director of Emergency Management, Indiana County. David Altrogge, producer of Vinegar Hill Productions, also an IUP grad. Brad Adams, a physics teacher at Homer Center High School. And David Loomis, Professor Emeritus Journalism, and also the editor of the Hawkeye. And talk a little bit about what's happening with the coronavirus journal, diary that they're doing over there in the Hawkeye. Thanks again to Dr. Brandon Vick and Liz Cook for helping out with production today. The mission for the Center for Community Growth is to lead individuals and organizations in and around Indiana County, advancing social, racial, gender, LGBTQIA, economic, and environmental justice. COVID-19 Indiana County is a regular broadcast designed to keep you informed in the coming weeks about the COVID-19 pandemic. We hope this remotely produced broadcast will help you understand how this pandemic is impacting you and the Indiana community. We'll be coming at you Sundays at 2, Tuesdays and Thursdays at 6. Each episode will be available for replay. I'm going to introduce right now Dr. Sybil Moore, who's going to kick it off with our first guest. Sybil.
Hello. We are here with Tom Stutzman, the Director of Emergency Management Services. Tom, are you there?
I'm here.
Hi,
Thank you, Dr. Moore.
How are you today?
I'm good. Thank you. How are you?
Good. I know there's a lot been going on recently. How has Indiana County responded to the threat of the COVID-19 pandemic?
Indiana County has been faring pretty well. County government had available at the time of the outbreak a small stockpile of PPE for us to be able to provide immediately to a lot of our first responder community, as well as many of the healthcare and long-term care facilities within the county. So we were pretty good at the outset. It has been very interesting because this type of disaster for us as an emergency management agency is quite different from what we're used to. Typically we deal with floods and storms and fires and disasters of that type of nature. In this case, this is a little bit different. This is more of a disaster of the healthcare community, as well as for those who aren't ill of the mind.
Can you tell us about the current state of the spread of COVID-19 in Indiana? We read that there's, at this point, 55 cases, I do believe. There have been 4 deaths. Is there contact tracking right now in Indiana? And according to the Pennsylvania Department of Health, 2 of the deaths have been in nursing homes. Can you confirm that? Can you tell us a little bit more about what's going on as far as the numbers are concerned?
Yeah, the numbers, what you've got to understand about the numbers is the numbers have been compiling since the beginning of March. So that 55 positive cases out of the close to, I think it's around 500 and some folks who have actually been tested, it is a number that has been compiling or building since the testing began back on March 16th, I think, was our first positive that we had, our first case that it was identified within the county. That's when the testing was done. Of course, we didn't see that first case showing up until late March. The number of deaths, and according to the Department of Health website, all 4 deaths have occurred from long-term care facilities. So when you look at the number of facilities in the county as identified on that Department of Health website, we do know that we have 2 facilities within the county that have positive patients, and that all 4 of those deaths occurred from that group of patients. As far as the community spread, anything that we're seeing today is community spread. When we started out, many of the original cases that were tested and identified were actually transported into the county from outside. As a matter of fact, case number 1 that was tested positive was an individual that was returning from a vacation, and that was patient number 1.
We're going to go over to you, G.
Great. There's been a lot of discussion about testing and about the availability of testing, and you just referred to it. It's been going on for quite a long time. It sounded like I heard you say about 500 tests have been administered. There are a lot of folks that are suggesting that in order to really come around to really recovery, we need to up that level of testing by a lot, by a whole lot. And that is likely going to change sort of our understanding of the extent of COVID-19 here in Indiana. Are you concerned about the relative lack of testing happening here in Indiana, and are you seeing that changing?
Well, there is a lack of testing, and there's a lack of testing nationwide. A lot of it had to do with the shortages of the testing materials. We're going to be ramping up, well, say we in Indiana County will be ramping up testing this week. Indiana Hospital, with the assistance of IUP, will be doing scheduled tests where an individual can, with a doctor's order, make an appointment to do that testing. Initially, the testing was limited to only those people who were showing symptoms. So at the beginning, because of the limited number of tests available and the duration that it was taking to get the test done, because if you recall at the outset, CDC was providing all of the test results. Then it migrated to Department of Health in Pennsylvania. So we were shipping local tests the whole way across Pennsylvania to find out if they were positive or not, which was leading to about a 8 to 9 day turnaround from the time someone was tested. They were almost back to full health again by the time they got a test result. Yes, there's a definite need not only for the testing of positive negative, but there's also going to be a need for testing of antibodies long term.
How do you, so there's been the reports, I guess IUP has announced that they're partnering. What's your evaluation of that partnership with IUP and the hospital, and what kind of numbers are you expecting to sort of see? And how will that work? Will people be able to, sign up, or, how will that work?
Well, at the outset, what the hospital is working with the IUP lab will be a little bit quicker turnaround with the test, because they'll be able to do the testing and actually get the results locally. Right now, the way they have it configured is with a doctor's order, you can make an appointment at the hospital to go and receive a test. So it's going to be basically someone who would like to have that test is going to have their doctor order it, and then they can proceed to the hospital for the testing.
So a couple of questions have come up throughout the show about kind of communication, about how folks hear about what's happening in the borough. And I totally appreciate happening in accounting regionally, and I really appreciate you coming on the program, and a lot of folks have come on. I'm involved a lot in within the borough, and we talk a lot about IU patties, and during the event known as IU patties, and during the lead up to this, there's a lot of times there's a pretty clear coordination of different entities to kind of prepare for it, and then there's regular press conferences of sort of what's happening. And I guess the question is, given the COVID-19, are there plans to coordinate in a similar way and to communicate in a similar way in terms of here are kind of weekly press releases of where it is, where the pandemic is happening here locally?
Locally, that information is not something that we're driving. Being that this is a health emergency, the Pennsylvania Department of Health is the lead agency, and what we're doing is providing support to their efforts. They, through their website and also through their press releases, are sharing information from my email minute by minute. I'm getting more press releases on a minute by minute basis from Department of Health than I can keep up with. All of the state agencies at the state level are supporting the Department of Health in the coordination of this event. So locally, and as I said, this is kind of a different type of emergency. Locally, without having a county health department, we're reliant on the Pennsylvania Department of Health to provide us with guidance and information on what they need. And they are working through in Indiana Regional Medical Center as the local hospital provider to direct how that testing will occur, how the information will flow. Our position and what we've been doing with the assistance of the county commissioners has been attempting to support that effort by providing the personal protection equipment that all of our first responders, the healthcare facilities, and that's the hospital and the long-term care jointly, are required to have to be able to deal with this ongoing pandemic.
So I guess I want to press a little bit in the emergency management plan. There's a communications person that's indicated. Is that position filled at the county? Are we?
Yes, that's actually Lisa Spencer, who's our public information officer. And Lisa's done a couple local spots with Renda Broadcasting over the last couple of weeks. You know, the hard part in this is looking at all of the information that's being released and trying to find what is specific to our local area. You know, Indiana Hospital's public information officer has been doing some releases. There's not a lot that is different for us than it is for anyone else. And it would become repetitive at a certain point if all we were doing was regurgitating the Department of Health press releases.
I get it. I appreciate that. So we're a couple weeks into sort of the pandemic around here. We don't see huge numbers here in the county or even in our region. We are unfortunately experiencing fatalities, but we are not necessarily experiencing the surge that we've seen in a lot of other places. How I guess would you evaluate where we are positioned, and how are you feeling in terms of reopening? And in particular, you know, we've had some of these places around the country where people are coming out and specifically protesting and you know, going against what seems to be basic recommendations from the CDC and the WHO and the Pennsylvania Department of Health that I think the county is all on board with. So where do you see our county and our region right now in terms of this pandemic? How you know, where should we be looking?
Well, you know, a week ago, Department of Health had advised us that we were going to see our peak somewhere on Easter weekend. I think our peak was a little bit delayed behind that. Now, I mean, the peak could have truly been Easter, but based on the numbers, our numbers increased dramatically after Easter weekend. We're now seeing an increase of maybe 1 or 2 cases a day, if that. So I think when you look at the overall region of southwestern Pennsylvania, we have seen a very nice decline in those positive numbers, even though the number of negatives is increasing, the number of testing is still occurring. We're kind of in that position now where we have flattened the curve, but I don't think we're to that point where we can return to normal. You know, if you look at the history of the Spanish flu in 1918, 1919, if we go too fast, we may end up with something worse. So even though we've got folks who think that we need to push this and reopen everything back to normal on March the 9th, I think we need to be a little more cautious, and we're going to need to look at how we can do that type of reopening and still maintain some of the social distancing that we're not going to see a return to 1919 again.
Right. So I guess one more question about that reopening and what that looks like. The governor's put out a date, I believe, of May 8th, where we're going to start thinking about reopening. Is there a similar, I guess, body of folks, the same emergency management folks that are thinking about what does that look like here in Indiana County, and what does that look like here in Indiana County for a reopening, if the governor's taking the lead on that on May 8th?
Yeah, I've actually had conversations with Commissioner Chairman Mike Keith about developing that steering committee, as it were, to look at what our needs would be in Indiana County. You know, for the most part, it would be related to county government. in how we return back to some semblance of normalcy within county government. For our part, at the county level, the majority of the closures are driven by the state and the agencies that license those facilities in some form or fashion. So for the public agencies, the privately owned organizations, there's not a lot that the county can drive as far as opening. But in the government levels, what the county can provide is kind of driven by what the state's providing, but we also need to be prepared for what we're going to do when we get to that point.
So a steering committee of some kind would probably be looking to put together.
Yeah, we're actually, and I know that the commissioners have selected a couple key individuals within county government, because we've got to look at facilities, we have to look at personnel. We've got various properties that have to be addressed that have been closed to the public and to the employees for several weeks now. So all of those things have to be looked at. We're also looking at the state's recovery plan, not only what the governor put out, but also what PEMA has as their disaster recovery program, for how what parts of that actually apply to the county as county government.
Right. So I appreciate all of your time. We do this Facebook Live, and so there's actually a live question that's been asked that I want to relay to you. I think it's a good question. It's, what is being done to communicate with the Amish community in northern parts of the county?
That's a really good question, because we have had lots of questions about them from day one. We have shared through the sources that we have with Penn State Extension and the contacts that they have within the community information that's relevant for them. We've had concerns because we've had reports of various family gatherings amongst the Amish communities throughout the county. We were aware of one wedding that occurred throughout this. So we wanted to make sure that we were providing them with sufficient information, and we used some of our internal networks to be able to communicate what was applicable to them to get out.
Okay. Thanks. Well, I really appreciate your time. Is there anything else that you would like to sort of let our audience know? I think there's been a lot of, one of the reasons this program exists is because there was a kind of a question about what's happening sort of locally, and folks got together and thought this webcast would be a good idea. Is there anything else you'd sort of like to let our community know about where we are right now that we didn't ask you yet?
Well, we're 4 weeks in, and today we were doing restocking of several agencies that we're providing personal protection equipment to. The one thing that I really think that has been truly beneficial in all of this is we have had many organizations that we weren't aware of that are providing in-home care, from pediatric patients to geriatric patients. We've also found a whole lot of people in the county who are willing to donate or make donations to assist those people who can't get equipment or need to have food. Working through the United Way, we've been able to set up some funding sources that allows individuals who've lost their income to be able to reach out through ICAP to get funding, as well as the food banks. We've been trying to share and coordinate at every level that we can within the county, and directing people who may have something that someone else needs to somebody who needs it. That's probably been the hardest part, is keeping track of where everything's coming from and where it's going. But our Health and Human Services subcommittees worked very well at that, and we've had great success in a lot of those cases.
Yeah, we've actually had a couple of folks on talking about masks and that personal protective equipment. Is it your sense that there's still a need in the county for that stuff? The homemade masks or any of that?
There is a need, and when the governor's order on Monday went into place for everybody entering businesses and everyone working in customer service locations had to wear masks, our phones lit up here. Because they knew that we had masks, and unfortunately our masks are earmarked for healthcare and first responders, but there is still a need out there. The homemade mask business has exploded in Indiana County. Thankfully, we've got a lot of people who are willing to do that. Now it's just directing who needs to who has to try to get those things resolved.
Okay. Well, I thank you very much, Mr. Stutzman, for coming to taking some time to answer questions. Will you come back again, maybe in a couple of weeks, and let us know where we're at?
Certainly, yes. Be my pleasure.
Okay. Well, thank you so much. We're going to take a short break, and then we'll be back with some folks that are providing this PPE across the county.